Well, we set up GALYIC in 1999. First and foremost, we have once a week youth group. So for 2.5 hours a week, young LGBT people can come and they don't need to fear about anybody shouting at them, shouting abuse. They can be themselves.
That works.
I got referred here by my nana. In her words, I've blossomed.
Coming to this group kind of made me feel a bit more normal.
And it's just such a difference to be able to be open with people.
Even find romance at times. It's brilliant.
Displays and, well, all sorts of different... I don't think the NHS serves the group of young people that I work with very well at all at the moment. I'd say the biggest problem, health problem for LGBT, that's lesbian, gay, bisexual, transgender young people in Calderdale, is mental health. And when I say mental health, I'm talking about depression, self-harm, attempted suicide, phobias, anxiety, and then of course linked into that is often alcohol and drug misuse.
I am now 16. It originally started when I realised I was gay around 12, 13 years old. I would describe it as being very, very, very lonely and isolated because you definitely have no one to talk to. I was getting bullied really, really badly, and I think it got a little bit too much, and I did attempt suicide, but didn't work properly. So. I think I've been bullied since year 8. Calling me gay and stuff and saying I was just really camp, but yeah, we'll have to agree with that because I'm really camp at times, but it was upsetting.
The level of homophobic bullying, I've witnessed it over the last 7 years. It's rising, so nearly every member of my group have experienced some level of homophobic bullying.
I didn't really come out at home because at the time I was staying at my boyfriend's, and then when I got home I noticed that my bedroom had been changed around, and my cupboard that I had kept a certain book in had been changed around, and obviously my parents had found out.
I can't stress the importance of the difference family, parents accepting the child can make, and literally it can make the difference between life and death.
My dad was alright with it because he had a suspicion for about a year, so he said. But I think it was just my mum who was alright with it, but not so much, because she was probably hoping I would get a girlfriend and not a boyfriend. And
cheers.
Well, Scotty's my first ever boyfriend. He's as camp as a raw tense, as some people would say.
One of the problems that young LGBT people face is accessing appropriate support. And most mainstream services, they're not aware of the needs of young LGBT people, so therefore they can't meet those needs. Whenever a young person contacts GALYIC, I get out the needs assessment tool and I interview them. It goes through sexual health, emotional well-being, the big section on mental health, alcohol and drugs, isolation. Quite often it's the first time the young person's been able to talk freely about being gay and about how that has affected their life. When we're finished, I then go back over it, and together we work out individual action plans. What's the next step?
I've recently started going to counselling sessions, which are organised by Jan. I went to go see Alinda.
It's difficult for young people generally to find counselling, but to find people that are actively supportive of a gay organisation, I would say, was even more difficult. We're funded partially and managed by the Primary Care Trust, Calderdale Primary Care Trust. And the PCT have always managed as well and have been extremely loyal to us. I guess if Jan wasn't there, these young people, what would they do, would be the question. Would they come here? Would they use other youth services, youth groups? Would they confidently walk into a a doctor's surgery or a clinic to access these services, I would say no.
The NHS needs to have a training programme. I would love to see when a young person turns up at A&E, they've taken an overdose, that whoever's there in the hospital understands the needs of young LGBT people and can ask sensitive questions and find out whether sexual orientation has got anything to do with that.
I think she's been a real help to the group and to me, and I want to thank her.